Welcome to Total Health Magazine. I'm your host, John Barson. On today's program, we are going to talk about dental tourism in Costa Rica. If you've had any problems with your teeth here in the U.S. and you don't have dental insurance, you know how incredibly expensive it can be to have dental work done. Today, we're going to talk with a gentleman from Brooklyn, Og, who just through coincidence happened to be staying in the same B&B I was in Escazu, but he was there on vacation, not to have dental work done. But he fell in love with Costa Rica after originally visiting there in 2015 to investigate, look for a dentist that could solve his problems. His teeth collapsed in his 60s. He got a quote from a dentist in Florida, $96,000 to fix his teeth. Well, Og was retired, and $96,000 just simply was not an option. So he started talking to people. He tried to find a less costly dentist, but of course, you can end up with a much less expensive dentist, but you can also end up with a not very good job done. And we all know how important our teeth are to the quality of our lives. Og, in his conversations with people, heard about Costa Rica, so he visited the country, found a dental clinic that he felt very comfortable with, and committed to having the dental surgery done there. As you'll see in my interview with him, he absolutely loves the end result. In fact, not only the end result of the dental work, but just fell in love with the country. He was actually there on vacation. Again, it was just a coincidence that he was there at the same time I was while I was looking into dental tourism. So I got his story. You get to hear it. And we did the interview at this phenomenal bed and breakfast, which you'll see more of in the interview, Cocina Eclectica, which I can't recommend enough if you're enjoying a stay in San Jose, and that's the area you want to stay in. The second part of the program, I visit the clinic that did the actual work on Og and interview the dentist, Dr. Alejandro Mora, look at their clinic, their technology, and get a grasp on their capability. I spoke with people in the waiting room, and I spoke with another patient about work that they had done there, and everybody was very happy with their experience at Dental Cosmetics in Costa Rica. And I have to say that while I was there, they're so advanced. I kind of felt like I was on the med bay of the Starship Enterprise. So if you're looking for a much more affordable solution if you don't have dental insurance, I can assure you that Costa Rica is the place where you can get very, very high quality work done by dentists who are absolutely as well trained as the best trained dentists are here in the U.S. Now, before we get to Og's interview, I've got to pay the bills. So I want to tell you that today's program is sponsored by Planet Safe Lubricants, and Planet Safe makes this particular product. It's called AIM Lube. You can look it up, aimlube.com. If you care about the planet like I do, and Costa Ricans, did you know that in Costa Rica, over 25% of the country is actually preserved in parks, land parks, and maritime parks? They lead the world in the percentage of their geography that is part of a massive conservation program, so that you and I and our kids and grandchildren and people from all over the world can visit these pristine jungles and ocean and reefs and volcanic areas for many, many generations to come. But at Total Health, we're also interested in protecting the planet. If you've read any of our environmental health articles or articles on chemical toxicity in the home, you'll know that that is an area of concern for us. And I'm very happy to say that Planet Safe Lubricants has solved the problem that many of us didn't even realize we had. And that problem is chemical toxicity from products like WD-40, PB Blaster, Liquid Wrench, Trizol, Tapmatic, Bronze Lube. Almost all of these aerosol can products are extremely toxic and extremely flammable and dangerous to your health and dangerous to the environment. But I can tell you with AIM Lube, because I use it everywhere, AIM Lube takes rust and corrosion off of everything. You can use it on everything from your kid's skateboard to your bicycle to your doors, your locks. You can use it in the shop. You can use it on your boat because it absolutely is impervious to salt water. You can use it in the shop. I have mechanic friends that absolutely love AIM because it's not flammable and it just takes rusted bolts apart and much, much more. So do yourself a favor. The next time you go into the store and you think, I'm going to get a bottle, another can of WD-40, try and resist the impulse. Get a little bottle of AIM Lube. That little 1 ounce bottle down there, that little 1 ounce bottle will outlast 2 or 3 cans of WD-40. and the 4-ounce can will outlast 6 to 10 cans of WD-40. So, and there's no disposal issues because AIM Lube is non-toxic, non-hazardous, non-flammable, and basically has no smell, so you can use it everywhere. So AIM Lube, you do your part to save the planet, switch from the toxic aerosol can products and go to Planet Safe Lubricants, AIM Lube. Now, let's go back to Costa Rica, and I hope you enjoy my conversation about teeth with our favorite Brooklyn native, Og. Where do you hail from?
Originally Brooklyn, now I live in the Poconos, Pennsylvania, and as much as I can in Costa Rica.
As much as you can. And that's considerable.
Yes, it is.
We're going to talk about this beautiful house that you've discovered in your travel. So let's talk. This is a dental piece, and you had a great story. So what was your let's hear your tooth fairy story.
Well, I was on vacation in Sedona, Arizona, and my bottom teeth just completely collapsed and fell out. My top teeth had many problems since I was a child, and I really didn't know what to do. So I came back to the state, back to New York actually, and started researching, and the local dentist that I talked to said for a complete upper and lower implant it would be about $58,000. I then contacted another jaw specialist in Florida. I believe he's one of the best in the country. He wanted $96,000 for the uppers and lowers. Finally, I started researching Costa Rica. I found these two dentists. They are operating out of Dental Cosmetics of Costa Rica. One of them does the design of the teeth, and the other one does the implant. I started coming down here, I guess it was January 2015, had the bottoms, 11 extractions and 7 implants put in, and that night I was talking to my wife and eating ice cream. It took 6 months for them to gel, came back, had the uppers done, and at the end of it I have beautiful teeth. Don't want to grin too much, for $30,000, a fraction of what those other guys were going to charge, and I'm very happy. Plus, I've got to stay in this lovely place in Costa Rica, Joanna's establishment. It's a B&B with the atmosphere is just unbelievable.
It is. I'm staying here. That's how we met. Actually, we met on Skype.
That's right.
You were back home talking to Joanna.
Yes, we developed these friendships where we even hate to let them lapse when we go away. So we do Skype, and that's where I met John for the first time. And I would recommend anybody out there at least research coming down here. One, if you could stay at Joanna's, you're going to love it. And two, I think you'll be very happy with the quality of the dentals here, especially in Escazu in San Jose.
Yeah, we're only about 4 blocks
from where my work was done originally. He has since moved. But yes, if you stay at Joanna's, you can walk to most of the good dentists here within 10 minutes.
Yeah, because I've got the last quarter of my teeth to do on Monday.
Okay.
So we've done all my lowers, did one side of my uppers. I'm having mercury removed.
Okay.
So I'm really excited about it. Apparently there was I can't remember how long I was in the chair yesterday. Oh, I'm waiting for the needle. I'm waiting for the needle. I'm all ready for that needle, that stab. I know it's very quick. Nothing. You started working on my teeth. Well, wait, you ready?
Are you going to give it to me?
I never even felt it. It was amazing. These guys are so professional. State-of-the-art equipment, state-of-the-art labs.
I'm much more of a coward. I was actually put out. For a few dollars, they will put you out intravenously. They can bring you back when they need you to move your mouth open or close, and I have no recollection or any pain or any discomfort from the whole procedure both times.
Let's see your teeth again. All right, there you go. Costa Rican teeth. Nothing beats them.
You almost can speak Spanish too.
All right, Agwell, I want to thank you for this.
Thank you.
And Joanna's, if you're looking for Joanna online, it's Cocina Eclectica. Eclectica. And her house is amazing, the different things that she's got around the house.
It's like an art museum. It really is.
It is. And she's a great cook, and she will take instructions from you, and she will cook anything you want.
That's right. If you have no teeth, she will purify everything so you could just slurp it down.
That's right. Steve's coming back from the dentist
Yes.
this afternoon, and he's going to be eating through a straw for a few days.
And
so.
Steve is actually getting the same procedure I got. He's getting full uppers and lowers in 3 segments each.
Yeah, so we'll be talking to Steve too after he gets back. Well, once he can start talking.
Yes, which should be pretty quick. If
Yeah, I can try and Photoshop the drooling out. All right, Og, well, thanks for this.
Well, thank you for having me.
And again, do your research as Og recommends. Do your research on dental in Costa Rica, and we've got links and everything for you here too on this clip. So,
You'll be happy.
Pura Vida.
Pura Vida.
Well, I want to thank Og again for taking time out of his busy vacation schedule to share his dental experience story, and you can see his joy, his love for Costa Rica has certainly grown since that first trip back in 2015. But not to leave it there, I wanted to actually visit the clinic that did the work. So that's the second part of the program today. You're going to meet Dr. Alejandro Mora, who headed up the team that did the surgery on Og, and the crown design and everything that was required to save Og $66,000. Is that not incredible? That's not an unusual story. In my travels around Costa Rica and the 10 days I was there, I constantly ran into people who either were there for dental surgery or dental work, or had been to Costa Rica for the first time to have dental work done. And in every instance, every single person had fallen in love with Costa Rica. One couple I met, they had saved so much money, they actually bought a house in Costa Rica, and now they split their time between the U.S. and Costa Rica, retired, and very happy with their time there. So without any further ado, oh, and by the way, if you like this program and you would like to follow us and you would like to get more information on dental health and other topics of interest so that you can make better decisions about your health, please click the subscribe button, that red button below, and subscribe to our YouTube channel. All right, here it is, Dental Cosmetics of Costa Rica. Hi, John here for Total Health Magazine and Total Health Television. I'm still in beautiful Costa Rica. I'm actually on my way to the airport, and I was talking with one of my, I guess you could almost call him a roommate. I'm in a B&B over in Escazu, and the gentleman from Brooklyn, Og, very Brooklyn, as you'll recall.
Yes, I do.
He was telling me his story about how he found Dr. Alejandro Mora here in, well, you were over in Escazu.
I was in Escazu at the time,
You
correct.
moved
But
over
he's
here.
been here already.
But he has
Yeah,
been here.
yes.
But I wanted to stop in and see Dr. Mora's facilities and talk to him about his background. Did you not start with, were you at CIMA?
I was at CIMA Hospital for a few years, okay, about 3 years.
Okay.
CIMA Hospital, or around CIMA Hospital, it provides a very nice environment for dental and medical treatments.
Right.
We moved out of CIMA because we were seeking something different, something more personable for the patient, something more private.
Right.
And we also wanted a little bit more room, and then we moved right next to CIMA Hospital. We were there for about 7 years, okay?
Okay.
And recently, in the past 4 months, we have relocated completely to this new area in Alajuela, right next to the international airport.
Right.
And
I mean,
so far,
actually
we're
within
loving it.
Within walking distance. I
Yes.
mean, like less than half a
Basically.
mile. So you can fly in, but you have hotels. There's lots of accommodations. It's an upscale area here.
I love it. I think it's pretty convenient for the international patient.
Right.
Surrounded with hotels, surrounded with restaurants, everything walking distance. It has an upscale feel, but it's not expensive, and it's also very safe.
Yes.
Closer to the beaches, less traffic
Right.
than around the city. So far, I've had very good comments, and I hope we can continue it like that.
Right. Well, I think so. I mean, it's all about the patients, and when the patients
Excellent.
rave about
Right.
you, I mean, because who raves about a dentist?
Yeah, exactly.
Right? Oh yeah, I went to the dentist. Oh, it was great. Oh,
Yeah, it's not necessarily a fun experience, but we try at least to make it more personable, more client-oriented, feel them at home. I mean, I don't expect it to be an easy decision
Right.
to leave your country to get a treatment like this.
Right.
It's understandable that the cost difference is important,
Yes.
but also the quality, as we were talking earlier
Yes.
as well. So we've tried to make the best combination out of it all, not have to decrease the quality, but don't have to increase the prices.
Right.
And I think that being in this location has also allowed us to do a perfect combination of that.
Right.
Okay.
And you do a full range of dental services. You're really well known for your dental cosmetics.
Correct.
Ergo the
That's our name. That's a brand. That's
the
how we
name, right?
started. But we have a full team of specialists.
Yes.
It's 7 of us.
Right.
Basically, we have a full range of dental procedures, starting from the most basic. We will be general dentistry.
Yes.
Your cleanings, whitenings, safe amalgam removal of mercury. We have a periodontist for gum and bone treatment. We
Right.
have a root canal specialist. We have an oral and maxillofacial surgeon that can treat everything from a wisdom tooth extraction to the most complex dental implant procedure.
Right.
Myself, I'm a prosthodontist, so I work in areas of cosmetic dentistry and restorative work, okay? So I think we have every area of dentistry covered, and it is important for a patient to know that it's not only about cosmetics.
Right.
It's about function. It's about making the best blend or the best combination out of it. This is our OR. Okay, it's an operating room specifically designed for oral surgery. This is where my partner, Dr. Andres Fernandez, who is an oral and maxillofacial surgeon, does all his work. Right now, he's undergoing a major dental implant surgery of a
Right.
young patient. This is an area that has been specifically designed to treat this kind of operations.
Right.
We don't use a normal dental unit. We have a specific surgical unit, which is more comfortable, provides for more comfortability for the patient, but for
Right.
the surgeon as well to move around.
Well, also, I love the big screen. I mean, you've got the
That's
digital.
amazing. Basically, what we were seeing earlier
On
on the
the-
CT
on the
scan, the
CT
3D
scan,
unit,
right.
we can see that in the screen, okay? And that allows the surgeon for immediate reaction, immediate changes on his treatment plan or in his diagnosis
Right.
to go one way or the other,
Right.
okay? He doesn't need to go out and recheck the image. He can do the same manipulation of the image, segmentation and moving around in here as he does right at
Right.
CT scan. So it has special lighting, special painting, special paint on the walls
Right.
to make it easier and properly to clean, right?
Right.
So basically have like a hospital-based OR,
Right.
but for dental needs here
Okay.
within our office.
Well, one of the things in talking with patients from the dentist I visit to have my mercury taken
Yes,
out on my
right.
way here, it's amazing like how your staffs and yourselves, you lead the patients like by the hand, and you inform them every step of the way. Like
Yes,
they're-
we feel that's very important.
Yeah.
We feel most of these patients will come in. Some of them will come with their spouses, okay, but some
Yes.
of them we have women 67 years old traveling alone
Yes.
into a country that they don't necessarily have ever come before.
Right.
Sometimes we have patients from Middle America that have never even traveled outside of their own state.
right.
They got a passport to come and see us. So you got to put yourself into their place, right? And
Right.
feeling welcome, feeling in a friendly environment,
Right.
making sure that we're only that we can if we can, we're gonna walk in from the hotel to
Right.
here, because that's not everyone will need that, but it's good to know that the service
there.
is offered in case you need it.
Right.
And I think that service and that familiar feel is really what continues to drive patients coming back.
Right.
Word of mouth is super important these days.
Yes. Especially with
and
Yelp and the internet.
yeah.
Right.
So I mean, and it's good to know that yes, the dental treatments are done the right way. The dental treatments are successful. People are satisfied with the results. But more important that they feel at home. They will send their families. They will send their sons, their husbands, their wives,
Right.
their friends. So that makes you feel whole that you're in the right way.
Right.
And that's
And
to
one
me is
thing
very important.
I can certainly attest to, having done the walkthrough and looked at all of your facilities. It's state of the art. I mean, you have your own CT scanner.
Yes.
You have, so you immediately can see in 3D what's going on in everybody's mouths and their heads. It has way more potential, as you were saying off camera
Oh,
too.
absolutely.
You're also moving your lab, because you also have a lab,
Yes,
your own lab.
we
right?
are. We try to. An important part of the dental tourism business, so to speak, is to be able to provide quality of services at an affordable cost. But you need to be able to do that in a specific
Amount of time.
and that initially can be very demanding for dentists. Okay,
Right.
and we have learned that through technology, you can, obviously experience and training is important, but that through technology, you're able to do things in a more predictable way in less amount of time with better results.
Right.
Okay. The 3D scan unit, the CT scan unit, is definitely one of the best tools that we have. The most commonly used is for the diagnosis and treatment plan for dental implants.
Okay.
You can also detect abnormalities in anatomy. You can detect possible malformations.
Right.
Okay, sort of a cancerous malformation, a
Right.
tumor, etc. It serves very well to determine the quality and the quantity of bone, okay, surrounding the important
okay.
areas
Great.
of where you. So that's why it's so important for the diagnostic and treatment
Right.
plan of dental implants. Okay.
Right.
So what we're doing right now is taking a 3D scan image. It takes about a minute.
Okay.
It's not really that uncomfortable as it looks.
Okay.
But it does provide a lot of information, so we're very grateful to be able to have this unit.
Okay. So this is the end result of the scan?
Okay, John. So this is basically you. This is your it's a 3D image of you. Okay.
Yeah, and it's not good news. Okay.
So basically, a 3D scan image, what it allows us is, as we were talking earlier, it allows us to do a better description of your anatomical structures.
Right.
Okay? Allows us to get a proper description of the bone height, the quality of the bone, anatomical structures such as the teeth, the TMJs, the nasal bones, the mandibular bone, and the maxillary bone. Okay.
So you see everything.
So we pretty much see everything, okay? Basically, what this does is that it allows us to make segmentations and cuts of each one of the areas
Right.
that are important to us, and it will allow us to, with a tool that this system has, allows us to take proper measurements of the
Right.
amount of bone present.
Okay.
This is important when we're thinking about placing dental implants, for example.
Right.
We want to make sure that the dental implant that we're going to be placing is the proper length and the proper width for the amount of bone that you have.
So this is all in 3D. So
This
you
is
could-
3D, so we can, these images over here are showing a cut, a segment
Right.
of this middle area. So this allows me to measure how thick the bone actually is.
Right.
When you have a 2D, the traditional 2D image or an X-ray, you only see a two-dimensional image that
Right.
allows you to determine height of bone,
Right.
but you don't know depth, you don't have thickness.
Right.
So you can select the proper length for the implant, but you don't know how width that implant needs to be.
Right.
And it happens often during a surgical procedure when you make your diagnosis with a 2D image that you actually have your surgical side open, you're
Right.
putting an implant, and then you figure out you don't have enough space for an implant. So what a CT scan really brought into dentistry was predictability,
Right.
okay? And a proper diagnosis. Make sure
Right.
that the tools that you have and the instrumentation that you have and the implants that you have are gonna be adequate for every single individual.
Right.
Also, this allows for, that's just a minimum part of what a CT scan image can tell you. I mean, this is also used for anatomical differences between one patient and another to determine possible illnesses such as cancer, tumors,
Right.
etc. So it does brought a broad span of information
Right.
that mainly is important for the diagnostic and treatment plan
Right.
part of it.
Right.
And honestly, we don't remember how we did things
Before.
before that. And the second part of it that goes hand by hand, at least in my prosthodontic area, which is crowns, veneers, it's very important to have a lab that understands the patient needs
Right.
and that can deliver the quality of work that we expect in the time frame
In the time
that we
frame,
need
right.
it. For that, having my own lab is super important. My own lab is located right now in San Jose. Part of the reason why we wanted a bigger space is so that I can have my own lab
Right
within
here
my facility.
in-house.
So right now I have my own lab. We have messengers going back and forth, but very soon we're going to have it in-house.
Right.
We have a CAD/CAM unit, okay? A CAD/CAM unit allows us to design your crowns, your veneers digitally. A machine will manufacture them, obviously designed by a dental technician.
Right.
And then a dental technician will do the finishing touches, the artistic part of the work.
Right.
But having, again, all this technology mixed together allows us to do quality work at an affordable price in a specific amount of time.
Right. So if somebody they could come down for 3 days and get a job done, or 1 day, or 2 weeks, or
Correct.
whatever.
It all depends on the patient's needs,
Depends on the
and
patient.
all cases are different. But knowing that we have that flexibility also makes for our business most successful.
Right.
If you look at it that way,
Right.
Because you can provide. We have people that work that they can only be away from work 3-4 days, and
Right.
that sometimes is important, or else you're not going to be able to meet their demands, right?
Right. So the bottom line is people need to do their homework too.
Correct.
Right.
Super important.
Make sure you do your homework. Find out from wherever your local dentist is. I mean, they could even bring their X-rays, but you don't really need them because you've got your CT scan unit.
Yes, it helps a lot. It's difficult to provide sometimes a proper treatment plan by email, right? So we can only come to a
Generalized.
We can come to, yeah, exactly, to something basic, so at least the patient understand what the costs are associated and take it
Right.
from there. Sometimes we have patients that will send us a treatment plan from a local dentist, and that sure helps a lot, because being confident that the local dentist has done a proper examination, then based on those findings we can come out to a very precise treatment
Right.
plan. But they can send their x-rays. Generally, we like to use our own CT scan here because it provides more information, but everything they can send out to send beforehand
right.
will help
To
at least
understand.
get the process rolling, and we try to minimize the amount of surprises, but sometimes changes can occur
Of course.
once we actually
Once you actually see the
correct.
especially when, as you pointed out, once you're in that, you see a CT scan. and
Oh,
now
yeah, that
you see everything in 3D. That's amazing.
And that doesn't allow for any surprises. I mean, you're gonna see everything. Nothing can hide from you
Right.
in the CT scan.
Yeah, I have to floss more. Okay, thank you for that. Okay, so Dr. Alejandro Mora, thank you very much for your
My
time.
pleasure.
I've got to head to the airport now, but you can follow the links. You're in very good hands with Dr. Mora and his team here at Dental Cosmetics, Costa Rica.
I appreciate it. Thank you for coming, John, and it's feel welcome.
All
We'd
right.
love to have you.
No problem. I'll be back for the laser whitening treatment for all my interviews. Okay, thanks. Take care.